My name is Lisa Cosgrove. I have a PhD in clinical psychology. I'm an associate professor at UMass Boston, and I'm currently a residential research fellow at the Edmund J. Safra Center for Ethics at Harvard. My study is on antidepressants and breast and ovarian cancer, looking at both the epidemiological and the preclinical literature, and we also looked at what correlation there was between industry-affiliated researchers and their conclusions about cancer risk. What we found was that there was a statistically significant, albeit small, increased risk of cancer when we looked at the epidemiological literature. What I think is even more interesting, though, is when we did the sub-analysis, teasing out the older antidepressants, that is the TCAs, and the newer ones, the SSRIs, selective serotonin reuptake inhibitors. What we found was that there was far less heterogeneity with the SSRIs than with the TCAs. So in other words, only one study in the sub-analysis of the SSRIs did not find an increased cancer risk, whereas when we looked at the TCAs, the results were more mixed. I think one of the things that our study tells us is that we certainly need more research specifically looking at SSRIs and increased cancer risk. What interests me so much about this conference and about Dr. Calabrese's work is trying to find some explanatory mechanisms for why there might be this increased risk and why some researchers would find an increased risk and some wouldn't. And one, I think, fairly robust hypothesis is that there could be a biphasic response. That is, perhaps at low doses or with short-term use, SSRIs might cause an increased cancer risk, whereas at mid-range or high doses, they might not pose an increased risk. I think this is particularly important given the number of women who are currently taking antidepressants. The vast majority of folks who take antidepressants are indeed women, and often female oncology patients are given antidepressants prophylactically because there's the assumption that they'll probably be depressed. So in light of these and other factors, I think testing for the possible hormetic or biphasic response is really a critical public health issue. One of the other related points is that I think certainly low-dose responses can't be assumed not to exist on the basis of high-dose studies. And that's something I think that regulatory agencies such as the FDA really need to grapple with in terms of developing policies that genuinely protect the public's health.